think one of the greatest myths that has prevailed for the last essentially several at least century or so is the idea, this myth around dehydration and electrolyte imbalance. There are experiments that in scientifically published experiments in peer-reviewed journals dating back to the 1940s and repeated dozens of times since that show that alcohol doesn't actually cause any significant amount of dehydration. And the what you're experiencing the next day has essentially nothing to do with dehydration or electrolyte imbalance or anything like that.
Hey everybody, welcome to the Decoding Cocktails podcast. I'm your host, Chris LeBeau. At the ripe age of 38, I left my former career behind and joined the hospitality industry. Since then, I've been on a rapid journey of learning, meeting all sorts of great people, and this podcast is my chance to bring you along with me, whether I'm interviewing somebody that works in the industry, another enthusiast, or occasionally stepping back to share what I'm working on or my thoughts. I'm so glad you're here, and so with that aside, let's get into today's episode. What's happening, everybody? Welcome back for another episode of the Decoding Cocktails podcast. I have a very intriguing episode, and maybe you can envision something like this in your life or your field, where there is a myth or a belief that just won't go away. So apparently, one of those myths in the world of alcohol is that hangovers are caused by things like dehydration and electrolyte imbalance. Well, apparently on the back of research that has really been in place since the 40s and 50s, it's very well documented. These things actually are not shown to be the primary cause of hangovers. And this is the moment when everybody goes, say what? But I've been hydrating, but I've been drinking Gatorade or whatever. So my guest today is Zack Abbott. He is an immunologist and PhD in a lot of things that are just, he obviously went to school for a long time, so I'm pretty sure he knows what he's talking about. But Zack helped found the company ZBiotics, and what they have discovered is that when your body is breaking down alcohol that you're consuming, one of the byproducts of it is called acetaldehyde. And this stuff is highly toxic. Now, much of it, when it reaches the liver, is actually broken down very efficiently, but some of it remains in the gut. And when it remains in the gut, it gets absorbed into the body, and this stuff is highly, highly toxic. So this is actually one of the primary things that causes the effects the day after drinking. So with his immunology and whatever sciencey backgrounds, Zack and his team began to say, well, if there's acetaldehyde lingering in the gut, and we believe this is causing a hangover, what can we do to keep that from being absorbed into the body? So insert ZBiotics. We're going to get into a lot of really cool things in terms of where do hangovers come from, what have we been doing to prevent them, things to think about with respect to, for a lot of us. Zack will kind of tee up some really fun ideas of like whether wine makes you sleepy or tequila makes you crazy. He's going to say that that could be true, but sometimes, because hangovers are multifaceted, but Zack is quick to point out that some of this is actually psychological or environmental/social. So we're going to really dig deep into the hangover science. He's going to tell you about ZBiotics. He's going to talk to you about why they are proudly GMO. For the sake of it, since Zack kind of teed up things with me this way as we kind of got things going, ZBiotic isn't going to tell you that they are going to cure a hangover, but they have found, and you can look at the reviews, they are glowing. Since our conversation, I had my 42nd birthday, happy birthday to me, and I use some of their products. Now, as I get older, I'm working to just be more responsible in general, but I can report that after a night of a good number of drinks, woke up feeling just fine. So Zack's also going to have a couple thoughts as well for you that's useful to think about in terms of when you need to stop drinking on any given night in order to ensure that you're going to have better sleep and hopefully wake up better rested. Again, none of this is like a one-for-one surefire, but general rules of thumb for thinking about this. This is a fantastic conversation, very eye-opening for, I'm sure, countless tens of thousands, likely millions of us out there. You can find them online at ZBiotics, BIOTICS.com, or on Instagram, and there are, of course, links to that in the show notes. Enjoy this conversation. So Zach, I see that this idea kind of came to you while you were working at an HIV clinic, and you're obviously working with various, drug delivery tools at that point in time. When did the idea of addressing dehydration and other effects that come from drinking come to mind? Was this kind of just more on a whim? You heard someone complain? Did you wake up maybe yourself after a long night on the town? How did this idea begin to kind of come to fruition for you?
Yeah, it's a great question. I love kind of telling the story of how it came to be. I'll say that I didn't just decide one day that, hey, what I'm going to do is, make sure that every day feels great the day after drinking. That kind of happened later. What happened, the original idea for this for what would become ZBiotics and the technology that's kind of the underpinning of the company came about, as you said, when I was working as a research technician in an HIV lab. And that idea was around the looking for the problem to solve there was a better way to deliver therapeutic proteins to people. And essentially, there's sort of like a bit of a long story that's maybe not terribly interesting for your audience about kind of like learning about essentially like a researcher had developed a protein that prevented HIV infection in his test tube model of HIV, and he had developed it purely as a research tool to understand how HIV infected cells. And when I was like, oh well, are you going to turn this into a drug? He was sort of like laughed. He was like, no, 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 it's a protein. They're very expensive and difficult to make, and it would be totally infeasible to administer that to people every day to prevent HIV. It was, merely meant as a research tool. And I walked away from that conversation thinking, wow, this seems like a really like basically said like logistics is the reason that we can't prevent HIV here with his tool. And so finding a better way to deliver proteins to people cheaply, easily, effectively was the problem I wanted to solve, and started thinking about the fact that you have this microbiome, this community of bacteria that live in you and on you, and they're constantly making thousands of proteins. And largely that's for the benefit of the microbe, but occasionally they tangentially make things that are sort of like symbiotic or beneficial for us as well. And so, thinking about ways to direct that or be very specific about that. And so I started thinking about probiotic bacteria, these safe, edible bacteria that we already eat every day of our lives, and they're making thousands of proteins. And so just engineering it to make another protein in addition to the thousands of other proteins it's making. And that single additional protein that it's making is specifically beneficial to you and targeted at a very specific need or benefit for the human for a human. And so that was like the foundational idea. And then what problem or benefit I would apply it to is like sort of a longer process. And really the concept of a genetically engineered probiotic was something I just immediately became passionate and excited about. But that idea sort of kicked around in my head for years. I wasn't really sure exactly. I certainly wasn't thinking about starting my own company. I was really just thinking about like, wow, this should exist, and I'm sure that other people have thought of this, and I'm sure there's lots of other people working on it. And I was surprised to learn as I looked into it more when I was in grad school, that there weren't actually a lot of people working on it. I'm sure a lot of people had thought of it, and there were several papers, academic papers published on the idea, but I was really surprised to see that there weren't like products already out there or lots of companies like working on this and pursuing it because it just seems so obvious and such low-hanging fruit from a microbiology standpoint. And then as I looked into it more and I was like, I think that if I wanted to do this, I might have to build it myself because I just didn't really see a lot of other people working on it, at least the way I had envisioned it. And so I started thinking about, okay, well, what are applications I could do? After I did my PhD, I was working at a company designing clinical trials for drug companies. And I think it is common for folks coming out of academia, especially in like the biological sciences, to really think about drugs and diseases. And so when we think about how we're going to apply our technologies, usually like, okay, well, what disease are we going to cure or fix? And I was no different. And so when I took this job after my PhD because I wanted to learn about how people apply technology to basically build drugs. And in the process of doing that, I came to realize that the drug industry is makes it difficult for inventors to kind of like they don't really value the inventor. It's not really set up for that. It's really more set up because there's there's sort of like strict regulatory guidelines and processes in place that there's a lot of upfront investment that has to go into that. And so ideas end up being a dime a dozen, and it's more like how do we execute and find the correct market for these things. And so while I think that all is very important, I just as somebody who was very passionate about the idea and the invention itself, and being sort of having aspirations to be an inventor, um, I wanted to have a more direct interaction with the end user of whatever I was going to build with these genetically engineered products. So I started thinking about, okay, well, what are opportunities in the consumer space, like for healthy people when they're not in a disease state? And so that is kind of where I started thinking, like really narrowing my list down of like, okay, what if I'm going to make a probiotic that's engineered to solve a problem, like let's think about like things I could do to help healthy people be healthier rather than like maybe fixing a disease state. And so I that started to narrow my focus and kind of get me focused on opportunities in that space. And so I had this list of like maybe 10, 15 ideas. And um, being a scientist who hadn't had a lot of experience in the consumer space, a lot of the things on the list weren't very good ideas. And so I originally was pitching an idea around the next, excuse me, helping you recover better from exposure to radiation, which I thought was like an interesting idea scientifically. I came quickly to realize that as I was pitching that not very many people were interested in that idea. And it wasn't like lighting anybody up. I was getting a lot of glazed over looks and things. And so one time I was actually at a pitch competition, pitching the idea for a genetically engineered probiotic. And in the last like slide of my presentation, I was like, yeah, but there's like, there's so many things we can do with this technology. We can do X, we can do Y, we can do Z. I listed off like a bunch. And then the last thing I said is like, we could even help you feel better the day after drinking alcohol. And yeah, exactly. I just saw the whole audience just kind of like light up, like just, a lot of like drooling, glazed over eyes, like don't care what I'm saying. Then all of a sudden, whoa, whoa, whoa. And then, at the sort of like meet and greet after this pitch competition that I definitely didn't win. People were coming up to me like, "Hey, tell me about that idea you had, about drinking and stuff." And I was like, "Oh wow!" So I started to realize that that was something people were interested in, they cared about. And look, the reasons on the list in the first place is because like I understood the problem and I understood like the biology behind that, and I thought it was like. I almost included it like half as a joke, like because I thought it was just like funny and something people would understand or whatever. But realizing that the fact that people understand it and that it's a common problem has actually made it a really excellent place to start. I think I undervalued how important that was. So that's why I chose to start there at the end of the day was that people were excited about it. They understood the problem. There was this visceral readout of efficacy. I was proposing to build and commercialize the world's first ever genetically engineered probiotic of any kind for any use case. And so it is incredibly valuable that people could try that new technology and feel whether or not it was working for themselves. Like that there would be like this like readout that was very visceral. So for all those reasons, I started to realize this is a perfect place to start, even though it wasn't at all what I had initially envisioned. And so that's really kind of how I got going down this path with this technology.
Totally wild. And yeah, the world of like scientific and academic pursuits meeting business and real world in terms of you're giving a talk and suddenly all the eyeballs like that is a market response right there, right? So
Right, exactly.
uh, so where I think I'd be interesting to go next is what do we I'll tell you what I think I know, but what do we know, Zach? I'd be interested to know about what actually causes hangovers because I feel like I've done some digging this on mine, plenty of malinformation, but I feel like I've dug at least reputable spots. But like, again, we are drinking alcohol, we become dehydrated over time. There are conversations about losses of electrolytes, or like, oh, hey, is it like withdrawal from sugar? And so, uh, we'll get to what ZBiotic does in a minute. But a lot of us, in addition to maybe drinking water, like while consuming the day after, we are often at times also like trying to replace things that we think we are losing. We'll get to how ZBiotic maybe circumvents that. But tell us about what we know actually causes hangovers, and they could be multifaceted, and there could be parts we don't know. But tell us what we
Right.
think we know about them right now.
Yeah, I think that's an excellent lead in to you're absolutely correct that it is very multifaceted and there are things that we understand and there's things frankly that we don't fully understand yet, which is amazing to think about, like something that seems so commonplace and simple as a hangover or the next day effects of drinking, that like we are still learning about that, but it is actually a really fascinating and complex biology. The I think one of the greatest myths that has prevailed for the last essentially like several at least century or so, is the idea, this myth around dehydration and electrolyte imbalance. There are experiments like in scientifically published experiments in peer-reviewed journals dating back to the 1940s and repeated dozens of times since that show that alcohol doesn't actually cause any significant amount of dehydration, and the what you're experiencing the next day has essentially nothing to do with dehydration or electrolyte imbalance or anything like that. And so I think the myth exists because it sounds like it makes sense, right? And like it aligns with our observations of what happens to us when we drink, which is that like we know that alcohol inhibits the antidiuretic hormone, which is essentially the hormone that your body uses to tell you to recycle water rather than pee it out. And so alcohol inhibits that, so you end up peeing more. And we notice that. And we notice when we drink a lot, we tend to go to the bathroom a lot and pee a lot. And so it's an obvious and a reasonable hypothesis to say, okay, well then like obviously alcohol is dehydrating you, and therefore the reason you feel bad is because you're dehydrated. But I think we all know, like deep in the back of our minds, that that hypothesis really doesn't make sense, right? Like first and foremost, other things that dehydrate us feel nothing like the way you feel the day after drinking, right? Like if you're hanging out, if you're eating salty foods or working out or doing anything else that causes you to be dehydrated, like you don't feel the same way you feel after you've had too many drinks, right? It's so that's first and foremost. And then secondly, the cure for dehydration, which is drinking water, does nothing for you when you feel miserable the next day, right? Like you can drink as much water as you like, and you're still gonna feel bad. It's still gonna just take time for you to feel better, and that's because it really doesn't have much to do with that. And like I say, there's lots of really cool and very simple and elegant experiments to show that like really like at most you're in deficit like one glass of water after drinking alcohol. And they did these really cool experiments. They showed that basically like they measured the amount somebody pees when they're drinking alcohol versus when they're drinking an equivalent amount of fluid of non-alcoholic beverages. And what happens is that you do actually pee one extra time right when your blood alcohol initially rises. But then after that, all the subsequent times you pee are just because you're drinking a lot of fluid, right? If you're drinking like if you drink like 4 or 5 beers, if you drink 4 or 5 pints of water, you would also be peeing a lot. And so it turns out that inhibition of the antidiuretic hormone is not all that impactful, and you're not like just stripping your body of electrolytes, which is again another kind of like common misconception that they show that like there's not electrolyte or glucose imbalances in people the next day. There's a lot of really good science around this, and so what is actually happening is interesting, and so there are essentially the effects of alcohol itself, the ethanol, and then there are effects of its metabolic byproduct acetaldehyde. And both of these play a role, and they have a lot of really interesting effects that happen. And so the alcohol itself, for instance, it monkeys with kind of like different hormone balances you have in your body. So in addition to inhibiting antidiuretic hormone, it also affects your hunger and satiation hormones, which is sometimes why you notice that even though you've consumed a lot of calories in drinking the alcohol, you may still feel like really you get this sort of like drunken munchies at the end of the night, right? And you're hungry and you crave like energy-rich food, and that's because it's actually stimulating the hormones that are normally stimulated when you're hungry or starving. And so that's why you crave these really energy dense foods. It also affects the way your body processes blood sugar. It binds to receptors in your brain that regulate your sleep wake cycle. So another reason why you might notice that even though alcohol can make you feel sleepy, you often notice that the next morning when you wake up, you didn't sleep well, and you don't feel well rested. And that's because it's constantly pulling you out of the deepest levels of sleep while you're sleeping. So even though you may have been in bed for 8 hours, you probably really only got 1 to 2 hours of quality sleep if you have alcohol still in your system when you go to bed. So those are some of the things that like alcohol has a really large impact on. The ethanol itself, and then the acetaldehyde I mentioned. So when you drink, alcohol is processed So alcohol itself is toxic, and then your body uses two enzymes to detoxify it. It uses one enzyme to convert the alcohol into acetaldehyde, and then it uses the second enzyme to convert acetaldehyde into acetate. Acetate is essentially vinegar. It's innocuous. You are fully detoxified at that moment. There's many other metabolic things that happen after that, but they're not really important for this conversation. And um, so those so when you drink, most of the alcohol is absorbed in your bloodstream. It circulates throughout your body. It has the effects it has, and then it makes its way to the liver, where it's broken down in two stages by those two enzymes really efficiently. So the first reaction and the second reaction both happen quickly, and so very little of that intermediate acetaldehyde escapes. And almost all the ethanol makes it into acetate. However, the story in your gut is a bit different. So some of the alcohol you drink before it gets absorbed into the bloodstream is broken down in your gut, in part by some of the enzymes that just the cells in your gut lining make, but in large part, it's by the microbes that live in your gut, so by your microbiome. And your microbiome is good at making that first enzyme to convert alcohol into acetaldehyde, but it doesn't make a lot of the second enzyme from acetaldehyde to acetate. So even though there's a very small amount, a relatively small amount of alcohol that's being broken down in the gut, it actually ends up being the major source of acetaldehyde, which is this highly toxic intermediate. And so colonic acetaldehyde levels rise to 10 to 100 times higher than blood acetaldehyde levels. And so the gut, even though it's a minor source of alcohol metabolism, actually is like a major source of this other part of the problem, this acetaldehyde. And so this acetaldehyde forms in the gut, but it's a highly soluble molecule. It gets absorbed in the bloodstream, it diffuses throughout the body, and it wreaks havoc throughout your system. And then it eventually makes its way to the liver, where it's very efficiently broken down into acetate, but at that point, it's kind of too late. And so the effects of acetaldehyde are like a lot of the things that we associate with some of the worst parts of what the way you feel the next day. And so it's sort of that it basically causes this it can cause it basically can monkey up all the works in your cells. It can cause cell death, which causes like this immune response, and you get this systemic inflammation, which is responsible for kind of this a lot of the misery that you feel the next day. So uh, this sort of like that like stickiness and that sort of like sick feeling that we have, a lot of that is really due to your body dealing with the aftermath of the bull in the china shop, right? When you wake up in the morning, the acetaldehyde is now gone. But all of the wreckage that it created is still there, and your body is responding to that. And so a lot of that's why it just takes time for you to feel better the next day, because your body's just kind of cleaning up the mess. And there's not a lot you can do at that point to support it. At least we don't have anything yet. And as I say, there's a lot of kind of complicated things that are happening at that point that are really, and we don't fully understand them all. But what we do know is that kind of what sets off this domino effect is that initial kind of dose of acetaldehyde that especially comes from the gut.
Got it. So yeah, and I think I kind of foreshadowed this too. So to that end, so we have this residual acetaldehyde in our gut that is wreaking this havoc. And so with so many of the other products on the market, but they're not here to necessarily to body slam any, but the idea
Right.
is away from ZBiotics, the greatest thing ever in the history of the world, obviously. That, but with some of these other products out there that people might religiously take or enjoy
Right.
or lean on, they might be helping, but the problem is that there is this residual
Yeah.
toxin in their body that is not addressing. So this may breathe new life into them, but the problem is those toxins still are there to potentially to wreak that havoc right there.
That's exactly right. Yeah. So there are, yeah, and like you say, I'm not here to like,
Right.
body slam anything else. And in general, like I said, what you're dealing with the next day is almost nothing to do with dehydration or electrolyte imbalance. That being said, I mean, that's not to say that there aren't benefits to drinking water while you're drinking alcohol. It
Sure.
helps pace you, right? If you're alternating drinks and you're drinking, because what we really know is really amount of alcohol per essentially specifically ethanol, amount of ethanol per unit time that you're drinking. So
Yeah.
the faster you drink and the more you drink, the more likely you are to have severe symptoms the next day. So if you're alternating with drinks of water, that's going to slow down your alcohol consumption.
Yep.
Also, it increases your blood volume, which dilutes the alcohol, which dilutes like some of the effect, the next day effect. So there's a lot of benefit to hydration generally. It's just
Sure.
not that you're not, just not combating dehydration in that. So I want to be clear there. And then, as you say, there are myriad products out there that are trying to leverage things that we know are just generally beneficial for optimal body operation. So, a lot of them have antioxidants, and you're definitely going to have a lot of reactive oxygen species, especially from the acetaldehyde. Um, and they have like electrolytes, which never harm anything. I mean, well, I shouldn't say never. There's always too much of a good thing. But like in general, like they're fine. And vitamins and things like that. These aren't things that are negative for your health, and they could put your body in a position to respond better to sort of the insult from alcohol and acetaldehyde. But they're not directly kind of like targeting the key problem. They're more like kind of like a general support system, which I think is fine. But when I sat down to build ZBiotics, our first product pre-alcohol, the point was like understanding what actually is the root cause, and then can we build something specifically to target that? And I think that had been lacking before in the industry, and that makes sense, right? That like we largely have been looking around like what already exists that we could use to help us, and I think people have done a pretty good job of finding those things. But the fact is that humans have been dealing with the next day effects of drinking for the full 6,000 years of human history that we've been drinking alcohol, and yeah, it just so if there was sort of like some plant or root or vitamin that would prevent the way you felt the next day, we would have found that a long time ago. And these problems still exist. So clearly, like we needed to invent a new solution. And so that's what we set out to do. And I certainly don't claim that we have solved every element, right? It's a very multifaceted problem, but we know that acetaldehyde is a key part, a really important part of that problem. And so we built a product to help you deal with that specifically.
Zach, I don't want to pull you out of any sandboxes or whatever, but I feel like other things sometimes people will talk about is like, oh, like, and because I think in general, the more not good stuff, toxins or
Right,
things you
right.
put in your body, the more like you're putting yourself at risk in a way. But people will sometimes talk about overly sugary drinks, or people will talk about, oh, I can't drink red wine or I'll get a headache, or
Hmm.
whiskey makes me crazy. Like,
Right, right. Yeah.
you is there anything you can share with us about different types of alcohol or sugar, their impacts on the body? I know I hear some people maybe have like even like histamine reactions as
Hmm.
to certain things, but what can you tell us about some of the other things people sometimes ascribe to that beyond acetaldehyde? What
Yeah,
is
absolutely. Yeah, it's a great point. And the truth is, at the end of the day, that biology generally is complicated and everybody's biology is different. And so like people are going to react differently to different alcohols in different settings. And a lot of that, to be clear and to make it no less real, it's still 100% just as real and tangible. A lot of that is psychological as well. Like I mean that creates a real effect. Like a lot of people talk about like, yeah, oh, like tequila makes me crazy or whiskey. And a lot of times it's because like maybe you're ripping tequila shots with your friends at a loud bar. And so that's really kind of generating, so
this?
you're, the rate of the consumption of it. And so there's, and then, people talk about wine making them sleepy. And it's a lot of times, so you may be sitting in a nice, quiet restaurant in dim lighting and sipping your wine. It's like, yeah, well, that's a lot of that is
Have
having
you
something to do with it.
have you A/B like Zach would do? Have you A/B studied yourself in various environments while you're doing this thing? And yes, how do you
Right.
drink this one thing versus another thing, situationally, pace wise? Yeah, yeah, yeah.
Right.
Sorry, guys. Yeah, yeah.
Exactly. So precisely. So there is an element of that, but there is, as I say, the first thing I said was that everybody's biology is different, and alcohol is a very complex, to use a chemical word, to not be confused here, a complex solution, right? There's lots of like different things in that, and those things, like, so right, like in wine there's like tannins, and there's like histamines and histidines and like triggers of sort of like histamine and all these different things that are happening when you're drinking, and all that chemistry can react with your chemistry in ways that are unique or somewhat unique to you. So those things are real, and I would encourage people to really, I think, like just be, like you said, like very like rational and introspective about those things, like, and just know those things about yourself, and I wouldn't write them off. That being said, I think there are a lot of those things are sort of more on the edge. They're more minor to the effect. I think that the biggest effects you're dealing with are ethanol and acetaldehyde. Those are the key chemicals. But that's not to write off the fact that like you have congeners, which are these like byproducts of sugar metabolism into ethanol, and they create like the flavors that some of these alcohols uniquely have, and those flavors are nice, but some of them also do have like negative effects, and for some people they hardly affect them at all, but other people are maybe very sensitive. So for instance, a very common congener that you'll get in very small amounts certain alcohols is methanol, which is in high concentrations incredibly toxic. But in small concentrations, it's it's okay, or you can tolerate it, and it creates some of the flavors. And some people have no issue with that, and some people are just really sensitive. So congeners and so different alcohols have different amounts of congeners, so that can affect some people. But in general, I usually say that these are really kind of like more of the edge cases. And that fundamentally the best thing you can do for yourself is really just to observe how much alcohol you're drinking per unit time. You
Sure.
mentioned a few kind of caveats here, or embellishments, I should say. Um, Sugar is sugar, and if you're drinking a lot of mixed drinks, you're drinking a lot of sugar, right? If you were to just drink like three or four Coca-Colas in a night, right? That's a lot of sugar, whether you put alcohol in it or not. And that's not, and then you stack that basically response to all that sugar your body's having on top of the inflammatory response it's having to the alcohol and the acetaldehyde and the other things. And that's that's going to compound your problem. So
Sure.
avoiding sugar and sugary drinks is just good whether you're drinking alcohol or not. And then definitely in the context of like, choose your insults essentially. If you're having alcohol, that's your insult. So try to be good to yourself in every other way. Um, and then and then the other one that's really important, I think that I was surprised to learn about when I was doing kind of my dig into the academic literature on alcohol is caffeine. Caffeine is something that we really shouldn't be mixing with alcohol. It can create a lot of issues. So both physical and psychological. So they've shown a lot of studies show that like people who drink caffeine with alcohol are much more likely to engage in risky behaviors like drinking and driving or making bad decisions because you're like overconfident. You feel alert, so you feel like overconfident about your abilities. But the fact is, you're still just as intoxicated as if you didn't have the caffeine, but you maybe don't recognize it as well. So
Sure.
sort of these Red Bull vodkas and espresso martinis and things like that. Like, I'm not saying that never have them, but just be aware that like, and maybe in moderation, kind of.
Yeah.
Yeah,
Yeah, in general, like the word of one of the guys I like to this spirit importer, drink less, drink better, et cetera. But
exactly.
okay, so here's the deal. Everything in our cabinets and in the stores is screwed. Zach, your team has come in. We are going to be very careful, everybody. This is not a hangover cure. Okay. It's not a cure, but it can help with the day after. So I get some ZBiotic. Tell the good people what you guys have built and what in the hell that does. We've introduced the acid aldehyde. What in the
Right.
hell are we going to do about that, Zach?
Yeah, great. Yeah. So you're absolutely right. We were very careful about what the product does and doesn't do. So this product, it's a probiotic bacteria, safe edible bacteria you already eat every day of your life. And then we engineered it to express the same type of enzyme that your liver does to break down acetaldehyde. But now it has the ability to do that in your gut where this acetaldehyde is initially forming. So we've essentially just kind of as I say, the liver is very effective at doing both reactions, alcohol to acetaldehyde and then acetaldehyde to acetate. And the gut is very good at the first reaction, alcohol to acetaldehyde, but not so great at that second one. So we basically just gave via a probiotic, we've given your body, your gut, the ability to kind of deal with that gut derived acetaldehyde as it's forming in the gut. So the idea is you have a single bottle of ZBiotics. It's a half-ounce liquid shot. It has our bacteria in it. You drink that before you start drinking, and then the bacteria get into your gut. They wake up, they start making this enzyme, and then as you're drinking alcohol throughout the night, this enzyme is constantly being replenished and breaking down the acetaldehyde as it forms. And so that's fundamentally the idea. And so it's helping you deal with gut-derived acetaldehyde, which, as I say, is an important part of the way you feel the next day. There are many other things that are going on as well, which is, as you aptly put it, means this is not like a full hangover preventative. It's just another tool in the toolbox for ideally you're making a lot of good, responsible choices. So you're drinking in moderation, you're pacing yourself. Um, you're making sure it is really important. You're making sure you're getting plenty of good sleep. So ideally, you're stopping drinking earlier in the night so that I always say like you want your BAC to hit 0 right as your head hits the pillow, and then that really sets you up to make sure that you're getting good quality sleep. So it's one of these like great ironies of alcohol is that like when we're intoxicated, we want more of it for whatever reason. And so then we choose at like 1 o'clock at night, right before we leave the bar to get one last one right before we leave. It's like, how silly is that? You drink that, you go, and then it only starts taking effect as you're sitting in your Uber and then laying in bed, right? Like when you don't even, you don't need that anymore. That's not part of it. So really trying to cut yourself off earlier in the night, and front loading your drinks, and then so that you kind of like ride that wave down. So a lot of really responsible things that you can do to set yourself up for a great next day. And all these things are things that have been available to you before. And then we built one more tool. So like one thing that was very hard to deal with was that gut-derived acetaldehyde. And so we built a tool for that as well. And so if you stack all these things together, ideally you wake up the next day and you feel great and you're able to accomplish all the things that you wanted to accomplish. And I think that was to kind of go one step further. That ended up being what was the most, it became clear in the early kind of conversations I was having with people when we were thinking about building this product was what was it that people really, what was really the problem that people wanted to deal with? And it wasn't so much about the pain and pain avoidance, although that's obviously like the first thing that comes to mind. It was really more about the fact that it inhibited people from being able to get more done the next day or be fully present at whatever it was. So if they had their morning workout or healthy habits and routines that like if I'm gonna go out and enjoy drinks with my friends or go to a wedding or something like that, I know it's just going to disrupt all these other things, these
Right.
habits I've worked hard to establish. And so it was sort of like an either or decision for people. And so this was sort of the opportunity for people to be like, look, I'm in my 40s. I want to be responsible. I want to drink responsibly. But even if I do that, like I still necessarily not always going to feel great. So is there something else we can do to kind of help with that? So that's really the idea.
Um, Quick technical thing, Zach, just
Yeah.
from like a timing perspective, and like I don't know if
Yeah.
you have one or two scenarios. So you want your BAC to be at zero, ideally, when your head hits the pillow.
Right.
Would you walk us through a scenario of how someone, again, I've had a drink tonight, or like,
Yeah.
hey, my friends and I were watching the game, drinking beers for 3 hours.
Right.
What does that scenario look like to get it BAC of zero right there?
Yeah. To some extent, it's a bit individual to your biology. Like
Sure.
how much do you weigh? How much the enzyme does your body produce? And so it's hard to, without like doing a lot of careful breathalyzing tests on yourself and really seeing your rates. In general, a good rule of thumb for blood alcohol is somewhere between about you can reliably metabolize about a half of a standard drink an hour.
Okay.
And maybe up to a drink an hour at most. And so that's sort of like the reliable kind of, I'd say. So if you're kind of budgeting essentially then like 2 hours per drink, and your last drink of the night should be at least 2 hours before bed, then like could reliably basically keep your BAC at zero. So an example would be maybe like you say you're gonna go watch a basketball game with some buddies after work, and so you go to the bar at 6 p.m. You order your first drink of the night, and then let's say you have like three drinks during from like 6 to 9 p.m. Then like if you started drinking at 6, if you just sort of take 3 in 6 hours, then as long as the last drink was before 10 p.m. Your BAC should be at zero by midnight would
Okay.
basically be how you think about that. Like very reliably. And again,
Yeah.
everybody's biology is different. Some people theoretically could be doing it in an hour, and so their BAC be good to go at like 9 or 10. So
Yeah.
yeah,
For the nerds in the room, they can obviously study their own, but yeah, but just a general rule of thumb of how to begin to think about that.
right.
And so I know, to the point of obviously a lot of the ongoing conversations about responsible and whatnot. What we're not saying with ZBiotics is like, hey, challenge accepted. Let's
Yeah,
go
yeah.
Taiwan to the next level. But in general, Zach, again, biology is a complex thing.
Right.
But for people who are having a Z biotic, again, maybe someone who's has a milestone 21st birthday or 30th
Right.
birthday coming up or whatever, in general, there are rules of, like if you tell people like, listen, like yeah, if you drink a case of beer, which we definitely don't recommend, but like there's a point in time which you're still gonna have a. But is there a point in time where you tell people like, if you stay within these guardrails, a lot of times we're gonna roughly be assisting you again,
Yeah.
not curing anything,
Right. Right.
but how do you guys kind of roughly guide people if they're teetering on the upper end
Right.
of responsible for a night?
No, I really like the way you frame that question. I think it sets expectations appropriately. And that's exactly right. I think what I can say with confidence is that for most people, whatever you end up doing that night, ZBiotics will help you feel better than you would have felt otherwise.
Okay.
Now, better like may not be good enough, depending on like how much, for how your body responds to alcohol and how much you drink. So there, to really kind of like oversimplify, but to make the point, like you have the effects of alcohol and the effects of acetaldehyde, right? And the effects of acetaldehyde are really gnarly, and they're kind of like the worst part, right? And the effects of alcohol are not as bad. They affect the quality of your sleep, things like that. But basically, the more you drink, like even if we're suppressing all the effects of acetaldehyde, the more you drink, the more magnified the effects of the alcohol itself are going to be. And we have no effect on that whatsoever. And so at some point, even if we're taking you from like, let's say a 10 out of 10 on like on the most misery scale down to an 8 out of 10, you're still feeling like an 8 out of 10, right? So it may not matter to you so much that we've helped you feel better because you still feel pretty bad. So there is like an element of that. And I think that everybody's scale is different, right? And everybody's like sensitivity to the effects of acetaldehyde versus the effects of alcohol are different. And so there's going to be varying experiences from person to person, and I can't like give like a hard number. But that being said, I think, and so I think there's some experimentation that needs to happen. But in general, like we see that we have a incredibly high customer satisfaction rate. That 95% of people who try the product feel that it really works for them, and that they perceive a benefit from that. And so that's an incredibly high success rate. And so almost everybody who tries the product says, yes, I think that this helped me. And I think that this created a benefit. And then it's sort of up to you to determine whether or not that benefit is worth it, or when what nights that's important. Like we have people who are like, literally, I will not drink a single drink without ZBiotics ever because it's just not worth it to me. And then some people are like, look, it doesn't really bother me that much unless I'm sort of drinking more than I typically would. And so then those are the nights that I choose to. And so I think that for everybody, they kind of find where ZBiotics kind of pre-alcohol specifically, sorry, where pre-alcohol kind of fits in for them in their life.
Yeah, yeah, yeah. Yeah, so I mean, might as well hear. So we're at the logistical part of things. So, is this all online only? So I know we're going to zbiotics.com. We'll be sure, of course, put that in the show notes and whatnot. But like, are you guys in any stores, Zach, or is this a thing that we're just getting this stuff shipped to our door? What do we need to know about care and handling, and where we should
Yeah,
look for this stuff? Yeah,
yeah. Great questions. So ZBiotics.com is the best way to get the product. And we essentially promise that the product will arrive to most people within 3 to 7 days. And shipping is free, and we pay for on the back end. We pay for 2 day shipping on everything. That being said, we learned the hard way through a lot of experimentation and trial and error and customer feedback that even if FedEx and UPS are telling us it's 2 day, it's not always reliably 2 day. And so we see that plenty of people do get it in 2 days, but for some people it just gets delayed. So we sort of promise 3 to 7 day shipping on all orders, and so ideally, so there is a bit of planning ahead, and we're working on that. We would like for you to be able to get it faster. People aren't always necessarily anticipating everything, so we offer ways for you to make sure you have the product on hand. And obviously, once you're sort of convinced by the product, then having a subscription or buying in bulk is like a very cost-effective way to make sure that whenever you need it, it's sitting in your house. But until you kind of get to that point, we try to get it there as quickly as we can. We're working on, we're essentially, our plan is in 2025 to start launching in retail and sort of finding the right outlets where the product needs to be and where people are going to find it and stuff. So that's a big initiative for us in this next year, is to get more into retail. But for now, it's just available online on our website. We also sell on Amazon.
sure. And I didn't remember looking at the SKU right beforehand, but yeah, it's the guy who ended up connecting us. This guy, this doctor Calvin, connected us when his comment was that his outlook was, yeah, it's kind of like, I feel like I'm buying myself. I think the number he remember quoting me, you can correct me, was like about $10 or whatever, or something like that. And again, here in the Midwest, at least where I am, I mean, when you're in nicer cocktail bars, you're at 14, 15, 16, $17 or whatever. But he's like, I kind of just view it as like I'm buying myself one more drink for the night. But like,
Right.
for him at least, he is one of those people. It's your comment. You use promo code Calvin. Just kidding. Don't do that. It won't get. Uh, but uh, but he was like, yeah, he was one of these people who was telling me about your product, and in my feed there you guys were, and I just wasn't paying attention up to now. But he was like, I just won't drink anymore without it, because
Right.
also he's got kids, and so like the next day he's like, they're up screaming, and he goes, "I got to be ready for that." So
Exactly. That's right. And that's commonly what people say to us. It's like, look, it's the cost of, for a cost of, of another drink, basically, like how much would you, like how worth is your next morning to you, essentially, and like how important is that to you? And
yep,
for the cost of a drink, it is. And yeah, so it's, I'd say, like if you're buying it ad hoc, like as a single purchase, so we offer in 3, 6, and 12 packs.
sure,
It ranges from $9 to $12 a bottle.
there you go.
And one bottle's good for a night. So something in the range of $10. But then if you're like Calvin and you're convinced and you're gonna have that on hand, there are ways we make it a lot more cost
More
effective.
cost.
So subscription brings that cost per bottle down to something around like $7.20. And then if you buy in bulk, we offer like 50 and 100 packs, which people buy and then just like because the product is shelf stable for 18 months from bottling. So you can buy the product and kind of have it on hand for like that. And that's what I do. I just have like 100 pack on hand, and because I end up handing out to my friends and whatever. And so just having that product there is really valuable to me. And then at that point, the price per bottle comes down quite a lot from, I think it's like 6.50 a bottle for
Right,
a 100
okay.
pack. Yeah.
Interesting as someone who throws a fair number of parties in my line of
Right.
work. Okay, cool.
That's exactly how I view it. Yeah.
Um, I mean, this is a trove of info, Zach. Is there anything we haven't covered that you'd like to talk about? We'll be sure, of course, to link out to you guys and whatnot. But is there anything in the story or that you want to cover today at all?
Yeah, I guess like one thing that we touched on, but I'd love it's, as a scientist, it's something I'm very passionate about, and it's the
Sure.
mission of the company, which is, you'll notice if you go to our website or if you or if and when you purchase the product, that you'll see proudly GMO on every bottle and box of ZBiotics. And so we talk a lot about the positive use of genetic engineering. And so fundamentally, the mission of the company is about elevating the conversation above good or bad, or is it or isn't it, and sort of the GMO conversation, which is where we are currently, into something more rational and nuanced, right? That genetic engineering is a tool to make products, and I think there's a very reasonable debate as to whether or not some of the products that have been made with genetic engineering are good or bad for humanity. But unfortunately, the technology used to make those products has sort of been lumped in and conflated with the products themselves, and so now there's sort of a lot of fear mongering that's happening with a lot of brands. And so, as a scientist walking through the grocery store and seeing these brands that have no idea about know nothing about genetic engineering, and their products have nothing to do with genetic engineering, advertising that they're non-GMO. Like, for instance, like there's literally non-GMO water in the grocery store, right? Like water has no genetic information, right? There's no way you could possibly. So those things that frustrated me, right? That these are brands that are just throwing the technology under the bus because they think that it makes their label look better and that
Yep.
people are more likely to buy it. And that's really damaging humanity because genetic engineering can build products that are really valuable to humanity that support humanity's impact on the planet. Like there are things that they're literally I have friends who have companies that are engineering microbes to fix carbon from the air, like pull greenhouse gases out of the air, and then turn it into like recyclable, reusable, biodegradable plastics, as an example. So like there are incredible things we can do with genetic engineering, and unfortunately, um, that conversation in the consumer space has really been kind of co-opted by brands that are trying to sort of like greenwash their labels and make it so. All that is to say that at ZBiotics, we're really passionate about advocating for the positive and responsible use of genetic engineering and demonstrating that if done responsibly and transparently to build products that have a benefit for the end user, that genetic engineering can be something that people will feel comfortable with and they'll be excited about. And so, when we tell people that, like, look, we genetically engineered this, we built something that didn't exist before. And the only possible way that this product could have the benefit it has is because we engineered it to have that benefit. And it's purpose built for the problem, which was acetaldehyde. That we can create things that you want that align with your interests and align with your values. And so all that is to say that we're, we really want to have that open and transparent conversation with people. And so that's why we're very proud of the fact that we use modern biotechnology to make products that people want and that they're excited about. And we've seen that, today we sold about 6 million bottles. And that's 6 million times that people have openly and very transparently purchased a GMO, and they knew they did, right? Like we didn't hide it anywhere. It was right up in front and center. And so the truth is that most people, despite what kind of like these brands will have you believe is most people don't actually care one way or the other. I think there's sort of this perception that everybody's anti-GMO, and it's not true. Most people don't actually care, and or haven't really made up their mind one way or the other. And so, I think we are out there to show that like that this can be aligned with your values, and that we can kind of move this conversation forward. And not to say that all GMOs are good, but also say that not all of them are bad either. And so that it's just a technology used to make products.
I think that's great. Yeah, in terms of the idea of like reclaiming a space, and that at times, like a word doesn't mean what you think it is. There's a huge conversation in the food world about like organic doesn't always
Right.
mean what we think it is. And for
Right.
me, my own little thing is this idea of like, much like to what you're doing in your own way, like helping people have a better next day. I think the whole best step is like drink interesting things rather than just mindlessly sit around and just pounding things or whatever.
Right.
I
Right.
think
Right. Totally.
reclaiming this space of like alcohol is an interesting, dignified product, and it has that in many spaces. But this idea that sure you can use it to have a good time, but it shouldn't be viewed as this like it is a little bit the boogeyman in our world right now of like, oh, cannabis is better or like
Right.
sobriety, do whatever you want. But like we're waving around these like accusatory things. And so I think it's cool the idea to talk about, hey, sure, GMO could be applied poorly, but here's how it can be done with dignity and for the benefit of people too.
Right.
So I think that's really cool that you're doing that. That's great.
I couldn't agree with you more. That's a really great analogy. I agree that alcohol can sometimes face the same stigma that and like look, I don't think that anybody should be trying to like make the argument that alcohol is good for you. I think we all understand that like alcohol is not. That being said, I think that like when used responsibly in moderation, it can be a tool that is beneficial. It like helps people feel more social and helps people relax and things that like can be really valuable if kind of used in moderation. And so developing healthy and responsible behaviors around alcohol is totally a reasonable way that like society that we socialize with alcohol. That's just a fact. And so and I think in an era where people are trying a lot of all or nothings, it's nice to kind of have something that's very rational, nuanced, and balanced and reasonable.
This is honestly, I knew it was going to be great, but this has been a lovely conversation. Again, we'll link out to the website on Instagram and the socials. This is just all Z. So again, no dots or hyphens, just ZBiotics is what we're all looking for online,
Correct.
right?
Yes, correct. Exactly.
Perfect. Well, Zach, thanks so much for taking the time today. This is awesome.
Yeah, likewise, Chris. This was really, really fun. I appreciate you having me on.
Hey, everybody. Thanks for listening. If you enjoyed today's episode, I'd love it if you'd write us a review on whatever platform you listen on, or share an episode with a friend. The show notes are available at decodingcocktails.com/podcast. Happy cocktailing, everybody.